Welcome to the Vitality Audit. I'm your host, Dr. Sirisha Bhandaru. Dr. B, this is your place to pause and to reflect. If we have ever met, I know that we spoke about it. This is a topic that's very close to my heart. Before getting deep diving into the topic, let me tell you a little story. My husband and I got married in the year 2003. I know, a long time ago. And we moved in together to start our new life. Few years after that, my in-laws, my mother-in-law and my father-in-law came to visit us. We spent a lot of time together. We traveled a lot and we had a great time. What I noticed during that time about my in-laws is they were very active. They were very cautious of their health. They exercised every day. They went on walks. They did yoga. They ate healthy food. They did not eat processed food. They did not eat junk food. They had a good life going on for them. And then we went back home to visit both of our families, and we spent good amount of time. And then we moved to Pennsylvania for me to continue on with my education. This was August 12th. I very clearly remember because it was the day before my birthday. My mother-in-law called my husband to let him know that his father was very ill. He was in a hospital, and the doctors had told her to inform her children so they can come and say their final goodbyes. It was kind of unexpected because we had just spent close to about 7 or 8 months together traveling and making memories, and he did not appear to be ill or sick in the technical term of the word. And we go to visit them, and he passes away 4 weeks from the day we got the call. It was very unfortunate. And I was going through the records after he had passed, and he was diagnosed with congestive cardiac failure. And the doctors mentioned that the heart damage to the heart was so advanced that they could not do a whole lot to save his life. And life moved on. I finished my education, had my first child, started my practice, had my second child, or rather, our second child. And during this time, my husband and I, we gained some weight. You can call it we did not work out because we were too busy raising our children weight. You could call it we're tired parents weight. You could also call it we are not eating healthy because we are so exhausted with work and children that we don't have time for ourselves weight. Whatever be it. We were inching towards the other end of being overweight. And one night, I woke up in the middle of the night. I started crying, and my husband wanted to know what was going on. At this point, we had a kindergartner and a brand new baby, and my husband snored like a freight train. And at this point, he was also diagnosed with hypertension. He was taking medications for that. I think he was borderline pre-diabetic. I really don't know or remember. And he had high cholesterol. And I told him, I've not slept in months. The kids don't sleep. You're snoring. I'm exhausted. I'm tired. And this is a decade since my father in law passed. And there's more and more research coming about that snoring is not healthy and that needs to be taken care of. There is an indication or connection that snoring and sleep apnea could be related. So I encourage him to go get tested for sleep apnea to take care of snoring. I put my assistant on it. She calls around, finds a sleep doctor, sleep MD, who is able to test him to get a diagnosis to see if he has sleep apnea or if it is just snoring and to get treatment for one or the other. Anyways, he canceled the appointment because he has an important work meeting, and that did not sit right with me because I was worried because hindsight is 2020, right? So his father actually passed off undiagnosed sleep apnea and the complications that came with it, and now my husband is showing all the comorbidities or the conditions that coexist or indicate too that he may be having the same health issue. And that was the first thing I was worried about. And second, I had not slept in months. I was tired. I was exhausted. I needed some rest. Anyways, so I reached a friend of mine, Dr. Dasani. She practices in Houston and she does teach general dentists to screen, treat obstructive sleep apnea for their patients. Just a little side note, American Academy of Sleep Medicine is the organization that creates and sets the criteria for diagnosis for at all sleep health conditions. And they recommend that the sleep health conditions need to be diagnosed by someone who is trained, like an MD, who has training in treating and diagnosing sleep conditions. So the purpose of her course is to help dentists identify and see if whatever treatment options that we are able to provide is working or not. So I take my whole family, the entire family, both children, my mother-in-law, my husband, we go to Houston, camp with a friend, and day one was like a big aha moment for me. I had light bulbs going on, dots connected, and just so much information. And at the end of day one, we got to take home the home sleep test that you can test at home and then bring back. The purpose of this was to know if, like I mentioned earlier, to know if the treatment options that are provided by me as a dentist are working for the patient, not for the diagnosis, just to monitor the progress or lack thereof, whichever way. So I take it home, I make my husband test, I take the test back, turn it in, and I think it was a group of 8 or 9 doctors. All the tests were being downloaded at that point. She points to me and she's like, "You need to hang back, and we need to go over this test one more time." Um, the first thought that came into my head was, did I mess up the test? Anyways, at the end of the day, she sits me down and we start going over the numbers. Just a little side note. American Academy of Sleep Medicine comes up with criteria, like I mentioned, for any and all diagnosis of sleep disorders. American Academy of Sleep Medicine categorized the diagnosis of sleep apnea into 4 categories: 0 to 5. If you have 0 to 5 incidences of either apnea or hypopnea, you're considered normal. If you have 5 to 15 incidences of apneas or hypopneas, you're considered to have a mild obstructive sleep apnea. 15 to 30 is considered moderate obstructive sleep apnea. 30 and over is considered severe sleep apnea. These numbers are per hour, not per the entire night of the sleep. Apnea is a health condition. So an apnea is a condition where there is 90% or more stoppage of breathing. Hypopnea is a partial stoppage of breathing. So my husband's apnea hypopnea number was 83. So just hang on to that number. There are 60 seconds in a minute, 60 minutes in an hour. So in 60 minutes, he was stopping breathing 82 times. So that's more than once a minute. No wonder he was tired. No wonder he was crabby. No wonder he was irritable all day long. So we come back home, and then he calls the doctor back, the sleep MD, to get diagnosed to see if this test was really accurate. So the doctor looks at the test, and my husband did not at that point have the textbook appearance to have such severe obstructive sleep apnea. So the doctor recommended that he go get a lab test. And my husband made an appointment. He showed up to the lab test. There, just another side note, there are 2 ways you can get diagnosed with obstructive sleep apnea, 2 modalities of testing. One is a home sleep test where you take the test home, you sleep with it, and you turn it in, and the MD read the numbers. And the second way is you go to a sleep lab where the technician dispenses the test. Either it could be a split night test where you are sleeping without a CPAP, and halfway through the night, they try the CPAP and get the calibration to a point where, or the pressure to a point where the apneas are and hypopneas are being reduced. So he goes to the lab to get tested because the doctor wasn't sure if the home sleep test was accurate. And normally it takes MDs, as busy as there are, 7 to 10 days to go over the results and get the patient back in to come up with a treatment option that's ideal for them. However, this MD calls my husband within 24 hours and they want him in their office. So my husband goes and to the appointment to see the sleep MD. And yes, he did have very, very severe sleep apnea, and he was recommended a CPAP. So he gets his CPAP, tries to wear it for the first night, and the pressure was too high for him. He couldn't tolerate it, and he puts it to a side. A little recommendation at this point. This was a decade ago, like 10 years ago. So I'm pretty sure that CPAP technology and the masks have gotten better, and easier to tolerate and wear. So if you have sleep apnea and you are able to tolerate CPAP, please continue using it. Do not stop it. And I want you to understand that CPAP is still the gold standard for treatment of obstructive sleep apnea. Anyways, my husband had other anatomical conditions that made CPAP usage very hard for him. We'll go through all these details at another episode. And now I want you to pay attention to one thing. There are two different people from the same family, my husband and my father-in-law. My father-in-law was a very active individual. He worked out every day, all his life. He was very long and lean. He had very little fat in his body. He was in the healthy BMI. He they ate healthy food. They did not eat high carb, high cholesterol foods. Um, my husband, on the other hand, is also a tall person, but he is stocky. He has a short neck. He has a broad shoulders, and they looked completely different. I want you to take a note of this, but neither of them were obese. So the myth that obstructive sleep apnea is an older individual's disease, older man's disease, a disease of obese people only, has to be discarded. It is very important to look for signs and symptoms that I will go through in our future episodes to see if you have even a milder version of the disease. If this episode spoke to you, if you know someone who can benefit from this episode, please share it with them. Join me every week as we cut through the noise and distractions and focus on what makes us thrive. Thank you for listening wherever you are. I'm Dr. B, your host, and this is Vitality Audit.